last. They need to live in something bigger than you. They need to live in your systems. Now, please allow me to provide a core concept. What a system is. A system is a repeatable way work gets done without relying on memory, reminders, or constant supervision. Examples: how staff engage with residents, how decisions are made, how leaders show up, how accountability is handled. CMS relied on that conclusion when it decided not to establish a separate LVN minimum, opting instead for a total staffing framework with limited role-specific requirements. How did licensed practical and vocational nurses get excluded? The ones who are managing the most critical aspect in long-term care settings. Medications. Redefining outcomes. As a healthcare coach, my coachings are all based on personal experiences, observations, and staff reportings. It is important that we begin redefining outcomes through empathy, compassion, and caring. And in this Coaching with Fright Awakening, it is definitely important to be applied in your everyday care and services when assisting someone with their AM care and nighttime rounds. Oftentimes, I have identified that the underlying triggers for behaviors such as combativeness, resistance, anxiety, restlessness, and agitation are all related to the approach and how the environment is handled by the caregiver. It is time to redefine outcomes. Let's talk about accountability versus blame. Let's define terms. Blame is personal. It asks who is at fault. Accountability, if done correctly, is structural. It asks what conditions produce this outcome and who has the authority to change those conditions. A strong safety culture is not the absence of adverse events. It is the presence of systems that capture, learn, and improve, including strong reporting and feedback loops. That matters because if accountability is reduced to punishment, reporting drops. And when reporting drops, learning stops. Well, just imagine how an individual feels when they are left in a bed in one position for an extended period of time. If you get stiff, imagine how they get stiff, unable to move their limbs or to adjust their body, laying with pressure on one side, on their shoulders, their elbows, their hips, their knees, their ankles. Blood flow decreased because they've been laying there for such a long period of time. The discomfort, the pain, the stiffness, having the mental capability to know that you're in pain, to know that you are lying in a position that you can't adjust, knowing that all you want is for a caring hand to come in and reposition you and give you comfort, relief, to be in your right mind but not have the ability to move your own limbs. Assertive communication, the gold medal. Assertive communication expresses thoughts clearly and respectfully. It balances confidence with empathy. It has benefits. It builds trust. It reduces conflict, and it encourages collaboration. Will you win your gold medal? Now let's talk about ineffective communication pitfalls, undesired responses. You become passive aggressive in your tone. There's a lack of clarity. There's interruptions or dismissiveness. And the consequences are misunderstandings, low morale, and missed opportunities. Be strategic. Be an active listener, ask clarifying questions, and use I statements. Know that there is an impact when a resident is rushed through a meal. Impact of rushed nutritional aid can lead to choking and distress. It places that resident at risk for pneumonia, compromising their well-being and their health. All too often, residents may even be aware of that risk. And the distress comes from trying to consume the meal at the rate that you are forking or spooning or pouring liquids and foods into their mouths. It strips away autonomy and dignity. They don't feel human. It does not have the personal touch of, I am here and I am here because I want to be here. It creates fear and discomfort. They don't feel like they are eating the food fast enough. They begin to feel like they are an inconvenience.